Hi, Ross. Hi. Chris Backrack, University of Maryland. That was a terrific presentation, very, very helpful for those of us who are still trying to wrap our heads around what models can do. I come from a very academic background, and one of the concerns that I often hear is how do we know that the right assumptions are being made in creating models? And of course, one of the things that academics argue about endlessly is causality, causal effects. And I'm wondering if you could comment a little bit on the issue of how certain do you have to be about the causal relationships of the parameters that you're putting into the model? How incumbent is it on modelers to really educate themselves about the disputes that take place, especially in fields like social influences and social processes that are not easily subjected to experimental designs?
Sure. That's a great and a very deep question. I'm sure my colleagues will want to weigh in on that, and I'm sure we won't resolve it based on my answer alone, but we'll keep talking about it all day. My answer would be that it depends, that the answer to that depends very much on what you're trying to do with the model. And I think it's a particularly vexing question when what you're trying to do with the model is make real-world decisions that have potentially high consequences, based in part on a model. But I think there's a variety of strategies to address that. All models, in my view, are essentially making causality claims. So inside the model, causality is very clear. And the question is the model of causality that's implicit in the model a one that also holds in the real world? And to do that, you have to assess that, you have to do a variety of testing approaches to your model to understand what evidence it's based on and what it does or doesn't show us about what we know in the real world, what it can reproduce in the real world, and various other strategies for building confidence, like multiple models and seeing whether they agree with different assumptions, and so on and so forth. That said, I think it's important to recognize that sort of by design, models are simplifications, which means that they're all missing something important that is true in the real world. And the question is the model useful for what you're trying to learn? And that requires a lot of care and thought. And I don't have a magic solution I can tell you in just 1 minute about how to do that, but that's a key question.
George Isham, Health Partners Minneapolis, co-chair of the roundtable. And I have a companion question to Chris's.
All right.
So since I'm not an academic and I'm more of a user on the private side, policymaker on the private side, and it occurs to me that in your last slide, the things that users should do.
Yes.
And my limited experience with interaction with models, both as part of the U.S. Task Force on Clinical Preventive Services, as well as some exposure to population health models. That what really is going on for policymakers is you require a lot more engagement and a lot more in-depth sort of interaction in order to get the kind of information that would be useful in making policy from the policymaker standpoint.
Yes.
So that's one observation. The second is that policymakers often don't have that time because they're making policy across a very thin range of issues and don't go deep in anything. And then the other observation, which may be more for the general Q&A question, is that I think there's a lot of work to be done in terms of the user interface with policymakers around what questions to ask. So in your 4 questions, which I can't remember right now, I wouldn't know what the right question to ask is.
Well, I can point you to papers that
you know what I'm saying. I wouldn't know when to to make the question about what the right model is. It's almost like there needs to be a general primer or user's guide, kind of thing for decision makers before they even engage in the specific models.
So I'll say,
so that's some observation, and then the last little thing is that I wonder if modeling is at the point where large-scale computing was prior to the advent of personal computers, which engage a lot of users in computing power. But now modeling is in the hands of experts like yourself and others who you know, it's a lot removed. You know, you've got to know how to interface you know, now you have to do the equivalent of interfacing with a computer through all those IBM punch cards and so forth, as opposed to some of the more immediate interfaces we have for computing today.
Three quick thoughts, all great points. The first is there are a variety of resources if you want to delve deeper into the discussion of what questions should I ask and when should I ask them, and sort of a primer, as you described it, for interacting with modelers if you're a policymaker. And there are a number of IOM reports actually that engage with that question that I'd be happy to point you to, including the one that I cited in my slides that just came out recently that's about tobacco policy. The second thing I would say is that in many successful interactions between modelers and policymakers, there turn out to be key translator people who in effect are conversant in the language of policy and conversant in the language of the modeling to a certain extent, and who can form that bridge between the two in a way that the policymaker themselves may not have time to do, as you so aptly put it. And certainly in the case of Midas, as one of the examples I highlighted, there were a couple key people who formed that bridge and who were absolutely central to the success of that effort. So I'm happy to talk about that. And the third thing you raised was this question about disseminating and decentralizing modeling as an enterprise beyond the realm only of the expert. And actually there is an important strain in modeling that's about participatory modeling and how you do that effectively and make communities or decision makers partners in the modeling enterprise, and in some cases transfer to them the ability to do some of it, some of the formative stages themselves. So that's a whole other topic that we could put. Great thoughts.
I'd like to add a point to that. A good model has to be a conversation between the modelers and subject experts and policymakers. And I don't think the subject experts have been mentioned directly yet. Modelers don't know all they need to know about the disease, about the condition, about the community, about whatever it is that's being modeled. There are people out there who don't know much about modeling, but who know a lot about the disease, the intervention, and the community. And a good model has to be a conversation among all of those people. The policymaker is only one of the people that comes in and says, okay, are you really, okay, tell me what you're modeling here in the way of interventions. Well, that's not likely to be the way we'll actually mount this intervention. Can you change it? Can you do this version in addition? So it's really got to be a conversation among a whole lot of people, and that conversation has to start early.
Kathy Bazzi, Chief Health Officer for the Dow Chemical Company and a member of the Roundtable. My question really is to the utility of models, and asking a question about, you mentioned that sometimes they have greater and lesser degrees of the needed information. And I'm assuming sometimes there have to be some assumptions that are utilized in the model because there just is not the exact information needed to feed the model. So I was wondering if models as a whole have a sort of confidence interval, so to speak. Like, how do you know the degree of reliability of a model, or the degree of accuracy, or the amount of information that was in a that was utilized in that's more in the estimating versus certainty, the level of certainty in the model, and do they then come? I was also thinking about troubleshooting models as maybe they are tested and they get serial versions, 1.0, 2.0, or whatever. And is there a way to sort of track the effectiveness of the model over time?
Yes, that's the short answer. There are ways to do all those things, I could, we could get into much more technical detail about how you do that. But yes, there are ways to develop what you might describe as a confidence interval for the results of a model, the sort of degree of uncertainty that's inherent in different estimates that the model's making. There's also ways to handle uncertainty about the inputs to a model by doing sensitivity analysis and sort of exploring how much the results depend on different assumptions that you're making. And that can be very important when there's unavoidable uncertainty in the real world. But it's actually really important, in my view, an important part of the exercise of modeling to be very clear about variation in the results of the model and what it depends on, because that's actually the most critical information in some sense for a decision maker, is given that we don't know what next year's flu strain will look like, how does our strategy and the success of our strategy depend on that thing we don't know? And what models can help you do is they can say, well, we don't know the answer to this, but here's a range of values it might have, and over here in this region of the parameter space, this strategy might do the best, but if it's over here in this region, this other strategy will do the best, or even better, here's a strategy that does equally well almost no matter which region of the space we're in. And those kinds of lessons can be very, very helpful.
I think another important point to make about that is, again, the subject matter experts and the policy experts are important here. The modeler doesn't know what the range of uncertainty is around a particular, how uncertain are we that people will take this vaccine? How uncertain are we that the vaccine is effective? The subject matter experts have a much better fix on that. And there needs to be a conversation between the modelers and the subject matter experts. What range of uncertainty shall we put into the model? Because it's from whatever range is put into the model that the overall sense of certainty or uncertainty about the model's results come out.
I'm Jim Nicklin, president of the New York State Health Foundation. I have two questions. One is, sort of the type of modeling you're talking about, where is the work being done developing these? Is there a set of people like yourselves at a Brookings type and then more academics doing more theoretical stuff? Is it discipline specific? Sort of where is the intellectual energy located? And the second question is, we've all been doing modeling, from a long time. When I first went to graduate school, economists talked about models and macro models and micro models and stuff, and social network models have been around for a long time. Do you see what you're talking about as a big flex point in modeling, or is this just the evolution of the modeling that scientists and social scientists have been doing for a long time?
Good question. Good questions. So first, I would say that the capacity to do modeling is very widely distributed, and it starts to depend a little bit what kind of modeling you're talking about, and different fields do tend to prefer different kinds of models. And we could sort of go down a pretty deep rabbit hole about talking about the different kinds of models and their mapping onto different kinds of fields in different parts of the academic and scientific arena. But in general, I think it's right to think that there's a distinguishable breed called a modeler, and that's a skill which is different than a subject matter expert or a policymaker, and it's a skill that is distributed in a sort of uneven way across the landscape. And I think you also sort of asked about, are we at an interesting disjuncture point? And I think in some ways, no, because a lot of the modeling that's done now is a natural extension and development of modeling approaches in general that have been around for a long time. That said, there are some new things, relatively new things, happening in the space of modeling, and many of them have to do with breaking down these walls between disciplines and across agencies in the policy space, and taking a more systems approach, as it's sometimes described. And there's a variety of tools that get called system science or complex systems modeling that are quite new to public health, even though they actually have been around in other places for longer. And that's a very new development in public health, and one that many people find exciting, and that I'm sure you'll hear about more later today.
So I'd like to add, of course, there's been modelers in lots of different places besides academia, and governments, and legislative offices, governor's offices do a lot of policy analysis, of course. There's been an effort to build that capacity in various public health departments, varying success. But you'll hear later today from Rajiv about health impact assessments, which are some other ways that I think have been trying to adapt some of the principles of modeling into some more practical, more rapid kinds of tools that people can use and actually get used by community groups and others, but use many of the same principles. So I think in some sense there's been a democratization of the modeling processes.
Hi, Sandy Magnin from the Institute for Clinical Systems Improvement and a member of the Roundtable. So I guess I want to build on some of that, the democratization, the use by consumers. If one of our jobs is to move us from a country that believes more health care is going to make us healthy to a different kind of thinking. So are there models, or how would we how would we marry up all this interest in gaming? Now, I'm way out of my sphere now, but gaming to me seems like a model, and that seems like a lot of stuff my millennial kids like to do, who hopefully will be future decision makers in policy realms. How do we marry up modeling around what makes us healthy, what's as individually and as a society, with some of this new way that people interact with technology and the breed of modelers, or this new way of thinking for future decision makers that might be our children and our grandchildren? What are your thoughts about how we would do that to bring the public along so that the decision makers can make some of those tough decisions?
There are a lot of people with modeling skills who aren't currently applying them to health. And people who are currently applying them to health weren't always trained in health, but kind of sometimes some of them moved into that field. So that's probably one of the ways that will happen. People who know a lot about modeling, about what goes on in a computer to make a model happen, will get interested in health. And what you're talking about when you talk about the kind of model you'd like to see is making health the objective function instead of just more health care. Models are very good at that. You can tell them, this is what we want to accomplish, this is what we have to accomplish it with, now tell us the best ways to do that.
But also the tools that we're talking about here are moving out of the very sophisticated laboratory into instruments that are accessible on the web and in other ways that give people and empower people to begin to play with these models, test their own assumptions, test their own community parameters against these things, so that people can begin to use them. And in my way of thinking, because models intrinsically are synthetic rather than reductionist, it'll move us away from some of the medical models, which tend to be very reductionist in thinking, towards thinking about the complex interactions here and beginning to understand them, and helping people understand the importance of these things that that are as we know, are very important to health, but lie outside of sort of these very specific interventions that we see in the medical world, because, as we know, the social and environmental things are all very heterogeneous. So I do think that there's going to be some empowerment that comes along with this, and we see that with many of the models that are here. And you'll hear about some later today, actually, where they're used in real time for groups to begin to use them. It's not quite like video games, but it's headed there.
I'll also just add that models are fabulous pedagogical and teaching tools, and they're in many places, then some of which you'll hear about later today, I hope. Modeling and how to use models to think about the world is something that's explicitly taught even at very young ages, in high school and before, rather than just something that's in the sort of the halls of graduate school level. So that's an exciting development as well.
Steve Wolf, Virginia Commonwealth University Center on Society and Health. My question for the panel is two very popular topics these days that I didn't hear mentioned very much is big data and machine learning. And I was wondering whether you could set those in the context of today's discussion. And I'm going to be guilty of ask and answering because I'm going to throw out a potential framework that I've been thinking about and want to get your reaction to it. And that is that the developments that we have seem to be going on two dimensions. If you think of an x-axis and a y-axis, on one axis is the growth of data. So the big data phenomenon in population health is talking more about integrating data from clinical, healthcare, EMRs, census data, environmental data, policy data, spending data, and so forth for a holistic, comprehensive look at the determinants of health. So broadening the integration of data. And then the other axis is high-end, cutting-edge analytics that are being applied. You talked a lot about some of these approaches, but the new focus on machine learning, statistical learning, the kind of thing that Amazon and Google and so forth are using to test their models of how to predict behavior, consumer preferences, and so forth, are now of greater interest in population health. And where those two axes intersect, that quadrant of the upper right-hand corner where you have these high-end analytics being applied to very large data sets. How does that fit into the role of modeling that you discussed?
So I would say two quick things, and I know we're tight on time, so I'll be brief. The first is that when thinking about big data, the immediate question that comes to my mind is how do you know it's the right data? And what do you do with it once you have it? And it's not immediately clear that the things we can now collect are the right things to collect at all. And even when we do collect them, the translation to something that's conceptually or policy relevant, it can be very hard. So there's a lot more work to do in that space. I actually think models can be an important part of answering those questions. The other thing that I would say briefly about machine learning is that there are many kinds of sophisticated analysis and modeling, and that's one of them. It has its own advantages and disadvantages. I would just point out that the circumstances in which the problem domain in which people like Amazon are operating is much more constrained and ordered than the problem domain in which population health policymakers and scientists work. And so it may not be that the exact approaches and methods used to great success by the private sector when what they're trying to do is sell you more things are going to apply when what we're trying to do is get people to change their entire life course trajectory. Just a thought.
You had a question, didn't you? Weren't you the last in line here? It's okay. Go ahead. We can take one more. We don't want to cut off arbitrarily when there's only one more person who wants to ask a question.
The first was just, is Pamela Russo, Robert Wood Johnson Foundation. The first was just a comment on the millennials. The foundation used to run a program called Young Epidemiology Scholars. It was like a Westinghouse for epidemiology. And the first year we were very surprised when one of the finalists was a modeler. And then every year we had high school students doing brilliant models. They almost always ended up in our finalist category. We had to add judges because we didn't have the judges who had the expertise to sort of question them about their models. So there's a whole generation of modelers headed our way. And then the second comment was just, wonder what on this democratization. I was involved with the development of a model where it had many assumptions, but they made the assumptions very transparent. And then users could change those assumptions if they chose to and run the model. Do you think that adds to confidence? Do you think that doesn't get used?
Yeah, I think that's a very good goal. And even when the model isn't set up so that it's easy for the user to use it, which is sometimes the case, it should be possible for the user to come back and say, I see you've made this assumption, what if you change it to this? That's what sensitivity analysis is all about. And that's what the policymakers and the users and the subject matter experts need to keep an eye on. All right, we thought this was the best study. You've used the mean value from the best study here. But what happens if it doesn't work out that way? What happens if people take up the vaccine more enthusiastically? Or what happens if they reject it entirely? Show us the results in that case. I think that the aspiration of the planning committee was that this workshop should be a conversation. And I think we've gotten off to an excellent start. So please keep in mind, if you're not a modeler, that you use computers, you use cars, you use air conditioning systems. You don't have to know how to build one or repair one to know what you want it to do and whether it's working properly.
Let's thank Louise and Steve and Ross for a great beginning.